Hi, my name is Vikki, and I studied the effects of mindfulness on social interactions. So, trauma can be defined as an emotional response to an event that causes physical or emotional distress. Some of the causes can include neglect, physical, emotional, sexual, or mental abuse as well. And some of the effects are decreased behavioral function, anger, anxiety, depression, and other mood and behavioral disorders as well. Mindfulness can be defined as a practice that brings one's attention to the present moment, and meditation is a practice that helps focus your attention to allow you to become mindful as well. In the current study, the hypothesis was that the implementation of a mindfulness and meditation intervention would decrease the negative social interactions displayed by the individual in the study. The participant of the study was a 14-year-old female who suffered from ADHD, bulimia, and disruptive mood dysregulation disorder. And the setting was a residential treatment facility, which consisted of children that were taken in by DCFS. And there were seven other girls living in this home with the participant, all ages of 13 to 17 as well. The research design was an A-B design, which consisted of a baseline and intervention phase. And then the variables included the independent variable, which was the mindfulness and meditation intervention itself, which is displayed on the right, um, just a snapshot of the one of the intervention days. And then the dependent variables consisted of social interactions, both positive and negative, as well as initiation versus response. For the procedure, the intervention was presented to a group of 8 girls with the focus on the one participant. The results here show that specifically in figure 1, that there is no overlap between the baseline and the intervention data. As well, figure 1 shows the significant increase in positive responses between baseline and the intervention data. In figure 2, you can also see that there is a decrease in the negative social interactions between baseline and data, between baseline data and intervention data. And there is an increase in the negative initiation during the intervention simply due to the overall increase of social interaction. In figure 3, this is a comparison of both positive initiation versus negative initiation. And it shows the increase in the overall positive initiation with a decrease in negative initiation. In figure 4, this is another comparison of positive response versus negative response this time. And this shows the increase in the overall positive responses with a decrease in negative responses. Overall, all of the figures together show the increase in the overall social interaction, and they show an overwhelmingly positive increase in the social interactions while showing a decrease in negative social interaction as well. So the results of the study do support the hypothesis mentioned before that the negative social interactions would decrease with the intervention being implemented. Some of the strengths of this study was that the intervention was implemented into the current structure that the participant is already used to, so there was no extra disruption with that. And then also the intervention was presented, so that way there was no one left out and there was no extra factors on the outside as well. Some of the limitations were COVID-19, of course, during our pandemic going on right now. Due to my own need to isolate, thinking I might have had COVID, and then my participant getting sick at the end, also to minimize any potential spread of the virus if it was present in her. There was also a repetitive style in the intervention, so that actually ended up causing some disruption in the participants' peers, which created a less immersive experience due to those distractions. And also due to the fact that this was a group presented intervention, it's unknown how the participant would have accepted the intervention on her own. Some of the implications are that mindfulness and meditation are effective in reducing negative social interactions, and the group presentation itself is also beneficial for the increase of social interactions. Future studies could stand to gather data from the entire group participating in the intervention rather than just one person, which would allow for them to um, compare different behavioral challenges as well as how different people are towards this intervention. And then also collecting data on the days that the intervention was not implemented. So, on days between intervention days, would also help show how the intervention is affecting the individuals as well. And then, of course, making the intervention a little bit more um, attention focused and implementing something that can keep the attention of the participants. And that's it. Thank you.